everyone, my name is Ashley Banks, and today for my informative health speech, I will be talking about the mental health condition known as bipolar disorder, and the title of my speech today is Shades of the Mind. I would like for you all to picture a picture-happy family. Just imagine such a joyful get-together just automatically turns so violent by a close relative. Imagine their confusion, dread, and amazement when they suddenly become more erratic and violent with outbursts of rage. Well, when my aunt, who's in this picture, who was suffering from bipolar disorder, suddenly attacked one of my parents when they were younger, my grandparents were left to deal with the intricacies of her illness and the roller coaster of emotions that followed after. I first would like to define bipolar disorder. Bipolar disorder is formerly known as manic depressive illness, and it is a neurological condition that results in erratic changes in your mood, in your energy, activity level, and even in the capacity for yourself to do daily duties. And this was from an article written by Abe in 2023. So the thesis statement that I have today, bipolar disorder is mainly a complex mental condition characterized by extreme mood swings, and in this speech, we'll explore the symptoms, treatment options, and the importance of understanding and destigmatizing this mental illness as a whole. My main points are going to be the signs and symptoms of bipolar disorder, treatment options for bipolar disorder, and ways to destigmatize bipolar disorder. So my grandfather was a former military veteran, and he dealt with severe trauma. He dealt with a lot of stress and anxiety from having to fight for this country, and he developed bipolar disorder. I'm not too sure if he was born with bipolar disorder, but from what my father was telling me and like my grandma, which is his wife, his mood just started to change once he came home from the war. And a lot of people have the misconception that, oh, if you're bipolar, you're crazy and you can't do daily things. And that was just not the case for my grandpa. My grandpa was a fighter, literally. He has such a caring heart. He didn't let his condition that he developed define him. And I'm really grateful to have had him as my grandfather. He sadly passed away a few years ago, but I just know that he was such a wonderful man, and he didn't let a condition define him. And that's what I want you all to take away from this speech, is that you might be dealing with something mentally, but it's okay to seek help. It's okay to talk about it, to have support systems. Don't keep it in, because it's just going to make you go insane, literally. And my grandfather always talked about his issues with our family, and I'm just so grateful to have had such wonderful talks with him. And I just want you all to know that understanding bipolar disorder not only impacts the victims, it impacts the families, communities, and even society. And I think we need to start educating ourselves about conditions like bipolar disorder, because it is a growing mental health issue that's going on right now. And I feel like your participation furthers a society valuing mental health and well-being, and that's what we need in order to prosper. So now that the foundation for bipolar disorder has been established, let's now examine its assortment of symptoms to gain a deeper understanding of this challenging illness. So the symptoms. Common symptoms of bipolar disorder are manic episodes. And when it comes to manic episodes, that is when you, as you see here on right behind me, the lady has her hands like this, like she's Manic episodes is when you're talking excessively, you have racing thoughts, you are more hostile, you experience less sleep, and you could become like a little bit delusional. Like you just see things that aren't there, or you hear things that aren't there. It's just, it makes your thoughts just all over the place, and a lot of people just don't realize that. So according to Abe, bipolar illness, as I mentioned, is frequently obviously experienced like with, as I said, the increased energy, decreased sleepiness, racing thoughts, impulsivity, and arrogance during manic episodes. So you're just very, as I said, irritated. Bipolar disease, longitudinal studies that I've found here behind me have demonstrated a correlation between manic episodes and changes in brain activity, namely in areas related to like more emotional processing and cognitive control. And as you see here, A is a person who is more healthy, who doesn't have bipolar disorder, and B is a person that has bipolar disorder. And as you see the comparison with A, there's more color in the brain, which means you're just thinking regularly. With B, it's all blue, which means like your mind is kind of like a roller coaster. It's blank. And it's just kind of scary how some part of the world are just fine and deemed normal, and then the other parts of the world are experiencing things like schizophrenia, bipolar disorder, and just other type of neurological issues that are affecting your brain and just affecting how you go about things in the world daily. And that's just scary. And I hope there's treatments, like better treatments, that will kind of help deter mental illness as a whole, because it is affecting a lot of people, especially minorities. And it's not talked about at all. It's always brushed under the rug. And it's okay to talk about it, which is a message that's for you all to take away with. So according to the American Psychiatric Association, which is an article that I found that was written in 2013, bipolar disorder is also characterized by cycling episodes of mania, as I mentioned, hypomania, and depression, which is on the right of this picture, which leads to impaired work and social functioning, which is why I include the picture of the brain, because it's just how you function daily. And it's just, if it's impaired, you're not going to be able to function right. Those grappling with depression and cognitive dysfunction tend to exhibit diminished job satisfaction, heightened absenteeism, and decreased work quality. As we shift our focus from understanding the symptoms and impacts of bipolar disorder as a whole to exploring potential treatment options, I believe that it's crucial to recognize the importance of comprehensive care in managing this complex condition. And here I also did a comparison too, before we get to that, of bipolar 1 and bipolar 2 disorder. As I explained earlier, bipolar 1 is mainly those who experience manic episodes. And this type of episodes will typically last for about 7 days. And those with bipolar 2 disorder, individuals diagnosed with bipolar 2 disorder will experience periods of severe depression, but rather of experiencing full manic episodes, experiences will be more milder. The mood swings won't be as much, and that may pass in less than a week. So it's a distinction between the two. So yeah, as I mentioned, we will now shift our focus from understanding the symptoms and impacts of bipolar disorder to exploring potential treatment options. So when it comes to treatment, medications including mood stabilizers and antipsychotics is crucial for managing bipolar symptoms and stabilizing mood. So mood stabilizing drugs are frequently the first line of treatment in the therapeutic landscape of bipolar disorder care. Among those pharmaceutical medicines is lithium and Depakote, if I'm saying that correctly, which ranks the highest. So when it comes to lithium, as you see in this picture here, it is a white and peach looking pill. Lithium is a naturally curing element and has been a fundamental component of bipolar disorder treatment. It does help with alleviating like more of like the manic and depressive episodes that are inherent in bipolar disorder. Depakote, on the other hand, is effectively stabilizes mood swings in bipolar patients. It operates by boosting gamma aminobutyric acid activity in the brain. And I just thought that was kind of interesting to see the comparison. And it's like more of like a pink pill, as you see behind me. I also think that treatments such as family therapy and cognitive behavioral therapy is also a good additional tool for controlling bipolar disorder and improving quality of life in addition to medication. Like I said earlier, it's good to just talk it out with your peers and not hold it all in, because that will negatively affect how you operate in life, and that's not what you want. And I believe that to like achieve like more of like stability and balance across mood episodes, people with bipolar disorder can also benefit from a customized approach to treatment provided by cognitive behavioral therapy. And I think this way because it involves assisting patients in recognizing and challenging negative thought patterns and activity levels. I also want you guys to take away from today that to improve symptom management and lower the risk of relapse, family therapy is an essential treatment option for bipolar disorder. Like I said, you're talking it out. You're with your family. Like your family, you're with them every day. So it's good to just talk your issues out with those you live with, and so that your family won't be out the loop, and so that your family knows, so that you know that you're not alone if you know that your family cares about you. So finally, I would like for us to discuss the importance of destigmatizing mental health conditions like bipolar disorder. I believe that education and contact-based interventions are crucial in reducing the stigma surrounding mental illness, such as bipolar disorder. Establishing channels of communication and increased comprehension is also essential to destigmatizing mental health issues such as bipolar disorder. Destroying these false beliefs that are out there in the world about bipolar disorder is a great attempt to open lines of communication and help improve understanding. I also think that we can dispel stigma and challenge preconceived notions by encouraging one-on-one conversations and spreading more knowledge about the facts of bipolar disease. And you can do this by spreading it like with, say if you have like an organizational fair, you can have a mental health fair, especially you can start with high schools because a lot of high school students are stressed, worrying about heading off to college, and just this type of anxiety and this type of mood swings can kind of spark once you start experiencing such high levels of stress. Because me personally, in high school, I always kept myself busy knowing that my family has bipolar disorder, and knowing that I can potentially get it as I get older. So I always kept my mind busy. I always participated in sports. After school activities, I was always in the musicals, just so I can keep my mind racing and my mind on track, because I don't want to fall off track and fall into a depressive episode, if that makes sense. And I really don't want to go down that path, but you can't really prevent things like that. You just have to stay positive. I also think when it comes to destigmatizing bipolar disorder, I think, like, as I mentioned earlier, narrative communication can help, can be seen as a powerful tool in destigmatizing mental illness. Storytelling, like as you talk in like a support group or you talk in like a therapy session, will help foster a sense of empathy, and it will challenge assumptions about mental health, allowing individuals to experience the lives of those affected. So you're seeing people's stories. Like today, this is storytelling right now. Like you guys are listening to me inform you all about bipolar disorder. So I just feel like getting it out and not keeping it bottled in will help give you a clearer mind if you are experiencing bipolar disorder. I also think that narrative communication helps with like promoting a deeper understanding and acceptance of the unique challenges that individuals with bipolar disorder encounter on a daily. So overall, in my conclusion, I would like to take the time to give you all more of a recap of the key points that were discussed in this speech. And I would like to emphasize the importance of understanding, supporting, and destigmatizing bipolar disorder and other mental health conditions that are out there. I want you all to walk away knowing that bipolar disorder may be a complex mental condition that are characterized by, the extreme mood swings and the different symptoms and treatment options, but always know that it doesn't define you, and you're not alone, because there are several people in this world who experience bipolar disorder. You are not alone, and it is okay to talk about it, and never just keep what you're going through bottled in, because it's not going to help you. It's only going to make matters worse. And after today, I would like for you all to know that it's okay. So after today, you have learned about the symptoms, the treatments, and methods of destigmatizing bipolar disorder. Hopefully, moving forward for you all, you can all get a better understanding of the seriousness of this mental health disease, bipolar disorder. And hopefully you can now be more mindful of those dealing with this whenever you interact with them, and instead of judging them, understand them. So, as Mariah Carey once said, who is diagnosed with bipolar 2 disorder, I am hopeful we can get to a place where the stigma is lifted from people going through anything alone. It can be incredibly isolating, and it does not have to define you. And I refuse to allow it to define me or control me. And these words resonated with me as someone who actually has family members dealing with this disease. It resonated with me because it just goes to show that we are all strong, and we are all capable of anything when we put our minds to it. And don't let something so minor and mild deter you from exceeding in life. And for me personally, if I ever do develop this disease, I just know that I'm a great person, and it doesn't make me a monster, it doesn't make me disgusting, and it doesn't define me. So I would like to thank you all for taking the time to watch my speech, and I can't wait to watch everybody else's speech. Thank you and have a good day. Also, here are my 5 references that I used in my outline and in my speech. Thank you for watching.